Todi sir, I don't think anyone else in India can talk about research more than you. So my second question is about the research from India, Indian data. We are probably in the initial stages or a further forward in with regards to our clinical research, especially in our specialty of intensive care. So why is this Indian data is not seen more often in international meetings and journals? So could you
You know,
please elaborate on that?
yeah, there are various reasons. When we did an exercise with ISCCM to produce a compendium of critical care research in India. 2013, we had an annual congress in Calcutta. At that time, we had this 5 year 8 to 13, 2008 to 13, what was the critical care research in India. And then again, we had a volume 2 of what happened in critical care research in India. And what we found that most of the work is in abstract form. Only 5% of those abstract had seen the manuscript stage. And that is where if you go to international congresses and meetings, Indian delegates are there, Indian researchers, the critical care community, they do produce abstract and the posters, but very few of them get into the manuscript stage. I think that is where the roadblock lies. And there are various reasons for that. The first is there is no protected time for the clinicians, because most of us are clinicians, which we do research along with our clinical practice. We don't have a separate protected time to do clinical research, which is given in almost everywhere globally in the developed world. They give few months, just they can devote on research so they can produce the manuscripts. So I think that is where the roadblock is. Apart from how to conduct research and RCTs, even without RCTs, there are a lot of very good research, which is, if you look at that compendium, it is available in PDF format. And there lot of work on ARDS, in sepsis, in toxicology, in hemodynamic monitoring, fluid responsiveness is there from India. But there are, like 50, 60, 70 patients. And the second is antibiotics. The sort of antibiotics that we use are not used so much globally. And we need to know what is the effects of those antibiotics in our community, in our patients. So that research is also done, but again, there are small ones and they are in abstracts. There are big research coming up from India, as you know, the research on scrub typhus, which was published in NEJM, severe scrub typhus admitted in ICU. Similarly, a few months back, there was on typhoid and paratyphoid epidemiology from India, again in NEJM. So there is definitely a prospect of doing these kind of research from India, but I think we need to get our abstracts into manuscripts. I think that's the most important things.
Thank you, sir, for the wonderful answer. Conversion of abstracts to manuscripts and the perseverance definitely. I think ICCM is in the right direction to achieve that goal in the coming years.
Thank you.